Welcome. Today, we delve into a fascinating and complex veterinary case study concerning transmissible venereal tumors, or TVT, in dogs, and their rare but significant spread to the brain. The study, published in the Journal of Comparative Pathology in 2025, presents findings from a retrospective analysis of cases seen at the Animal Pathology Laboratory of the Federal University of Campina Grande in Brazil. This research is important as it sheds light on the epidemiology, clinical presentation, pathology, and diagnosis of this unusual manifestation of TVT. Transmissible venereal tumor, as the name suggests, is a contagious neoplasm primarily affecting domestic dogs. It is characterized by the transplantation of neoplastic cells between animals, most commonly during mating. While these tumors usually appear in the genital areas, they can also occur in other locations due to social activities such as sniffing, licking, or biting. TVTs are generally considered to have a benign nature but can, in some cases, become locally invasive and metastasize to various sites including lymph nodes, skin, liver, spleen, and rarely, the brain. This study focuses on 6 cases of TVT with brain metastases, an exceptionally uncommon presentation of this disease. The researchers aim to describe the details of these rare cases, contributing to the differential diagnosis of nervous system diseases in dogs, particularly in regions where TVT is prevalent. Now, let's explore the study design. The researchers conducted a retrospective search of the biopsy and autopsy archives from January 2000 to December 2023. They were looking for cases of genital and extragenital TVT with central nervous system metastasis. The team meticulously reviewed clinical submissions, pathology reports, and hematoxylin and eosin stained slides of selected cases. Tissue samples, collected from autopsies, were fixed in formalin, processed for histology, and stained. The samples came from affected skin, genital mucosa, lymph nodes, the central nervous system, and abdominal and thoracic organs. Furthermore, tissue sections from these neoplasms were subjected to immunohistochemistry or IHC, a technique that uses antibodies to identify specific proteins in the tissue. They examined the presence of Vimentin, CD45RA, IDA1, lysozyme, MHC class II, CD117, CD3, CD79, and MUM1. The intensity and distribution of any immunolabeling were carefully recorded and graded. These analyses provided crucial data that allowed the researchers to characterize the tumors on multiple levels. Let's turn now to the results of this investigation. The study found that out of 6,218 canine submissions received over the 23-year period, 99 were diagnosed as genital or extragenital TVT. Among these TVT cases, 6 were found to have encephalic, or brain metastases, which constitutes a small fraction of the overall submissions, highlighting the rarity of this occurrence. The affected dogs were 4 females and 2 males with ages ranging from 2 to 12 years and an average age of 7 years. All of the dogs were from urban areas, with 4 being semi-domiciled and 2 being stray. Clinically, 5 of the 6 dogs had tumors affecting the genital area. These tumors appeared as multilobular, ulcerated masses in the vulvovaginal mucosa or base of the penis. The one extragenital TVT case had lesions affecting the skin and subcutaneous tissue, especially in the inguinal, abdominal, and cervical regions, as well as the inner surface of the pelvic limbs and back. The tumors varied in size from 3 to 11 centimeters in diameter. Notably, 3 of the 6 cases presented with neurological signs including lethargy, seizures, and ataxia. Other neurological symptoms included head tilt, head pressing, circling, falling, ventromedial strabismus, blindness, and obtundation. 1 dog developed many of these. 2 of the dogs were treated with vincristine sulfate, a common chemotherapeutic agent for TVT, but 1 was euthanized due to recurrence, and another died during surgery for tumor resection. In addition to the primary tumors, autopsies revealed thin body condition in 1 case and cachexia in another. Metastases were also found in the spleen, and various lymph nodes in some of the dogs. The brain metastases themselves were described as subdural and extraparenchymal. They were found mainly in the telencephalic hemispheres in 4 cases, including the left frontal lobe in 2, and the right frontal lobe in 1. In 2 of the 6 cases the metastases were located at the base of the brain, involving the optic chiasm, hypothalamus, basal nuclei, and thalamus. The metastases presented as well-demarcated, compact, soft white masses, measuring between 2.8 and 5 centimeters. These masses often caused compression of the surrounding brain tissue and a shift in the midline structures. Histologically, both primary and metastatic tumors consisted of sheets of round cells supported by a sparse fibrovascular stroma. The neoplastic cells had scant, eosinophilic, often vacuolated cytoplasm with distinct borders. The nuclei were central with finely stippled chromatin and a single nucleolus. There was low variation in cell size. Mitotic figures, which indicate cell division, were generally low in number, with most cases showing only 2 per 10 high-powered fields, and only one case showing 14 mitotic figures. Clusters of lymphocytes and plasma cells were also observed within the tumors. In the brain, the metastatic tumors were often seen to compress and sometimes invade the surrounding neuroparenchyma. Immunohistochemistry, or IHC, revealed that the neoplastic cells showed strong and widespread cytoplasmic immunolabeling for Vimentin in all cases. They also displayed moderate to strong membranous CD45RA immunolabeling in all cases. IBA1 and lysozyme immunolabeling varied between cases, and the researchers found it difficult to distinguish lysozyme labeling in the neoplastic cells from reactive macrophages. The neoplastic cells were negative for all other markers, including MHC class II, CD117, CD3, CD79, and MUM1. The intratumoral lymphocytes were positive for CD3 and CD79. Let's now discuss the implications of these findings. The study confirms that TVT is indeed endemic in Brazil, which is consistent with prior research. The study reinforces the association between TVT and dogs that have access to the outdoors, which facilitates the transmission of neoplastic cells. The age range of affected dogs, between 2 to 12 years, is in line with the typical age of sexually active dogs. While some studies suggest a higher occurrence of TVT in females, this study's small sample size made it difficult to draw firm conclusions on any sex predisposition. The clinical signs, as described in the cases with genital tumors and skin involvement, are commonly associated with this disease, and easy to recognize in clinical settings. It's important to note that the study showed that extragenital TVTs can be more challenging to diagnose, and that the neurological signs seen in the cases with brain metastases are highly variable and depend on the location of the tumors. The location of the brain metastases also correlates with the neurological signs observed in the dogs. The researchers noted that treatment with vincristine sulfate may not be effective for brain metastases because the drug may not reach the neoplastic cells in the central nervous system, due to the blood-brain barrier. The article mentions that TVTs usually have a benign course, however they may also be locally invasive and metastasize, especially in young or immunosuppressed animals. These metastases can result from mechanical extension or by autotransplantation from the primary site. TVT can spread to several parts of the body including lymph nodes, skin, eyes, liver, spleen, kidneys, lungs, heart, muscle, fat, and brain. Cytology is a useful diagnostic tool, especially with the characteristic round cells that have distinct borders and cytoplasmic vacuoles. However, histology remains the gold standard for diagnostic confirmation of both primary and metastatic TVT. The differential diagnoses for TVT include other round cell neoplasms such as mast cell tumors, histiocytomas, lymphomas, plasmacytomas, and amyloidotic melanomas. Metastatic TVTs in the central nervous system must be differentiated from other primary or secondary CNS neoplasms. The gross appearance of the tumors in this study were white masses, which can appear similar to meningiomas. However, the soft consistency of the metastatic TVTs before formalin fixation can help differentiate it from the firm consistency of meningiomas. Histologically, metastatic TVTs in the CNS must also be differentiated from gliomas and other round cell tumors. While histology is useful for routine differentiation, additional tests like IHC, molecular biology, and cytogenetics may be required for definitive diagnosis. The research confirms the usefulness of Vimentin, lysozyme, and CD45RA as immunomarkers for TVT in this study. Although not specific, their expression supports the tumor's histiocytic origin. The study emphasizes that lysozyme and IBA1 may not be reliable on their own as diagnostic markers. Molecular analysis of TVT reveals that the c-Myc oncogene is rearranged. Cytogenetic analyses show that TVT cells have a chromosome count of 59 as opposed to 78 in normal cells. These are valuable diagnostic tools that help confirm diagnosis. Treatment options include surgery, radiotherapy, and chemotherapy. However, chemotherapy, especially with vincristine sulfate, is usually the most effective. Unfortunately, surgery is not considered effective because these tumors are typically located in areas that are hard to reach and have an infiltrative nature. In conclusion, this study highlights the importance of including encephalic metastases of TVT in the differential diagnosis of neurological signs in dogs in endemic regions. The brain metastases tend to occur in the telencephalic hemispheres or the base of the brain, which causes a wide range of neurological signs. The authors emphasize that a combined approach of histology and immunohistochemistry for mesenchymal and histiocytic markers can confirm diagnosis. This research underscores the importance of being aware of the rare presentations of common diseases. The study also points to the complex interplay of factors that influence the spread and severity of transmissible venereal tumors in dogs. By understanding these intricacies, veterinary professionals can better diagnose and treat animals, ultimately improving their well-being. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.